Hi everyone, my name is Arza and welcome to my first ever pregnancy vlog. So since this is my first time, I would like to give you an overview. Today I'm 29 weeks and 1 day pregnant with my second child. So I learned that I was pregnant when I was 4 weeks, and actually it was totally unexpected because then I wasn't having my period for 3 months, and I wasn't worried at all because I have polycystic ovaries, which sometimes it's really normal not to have your period if you have that. And besides, I took a lot of pregnancy tests just to make sure that I wasn't pregnant, and yes, it was all negative. Even 2 weeks before I found out that I was pregnant, I took a test and it was negative. But me and my husband were very thankful that we're having a second baby, because you all know that all babies are blessings to all of us. And so at 6 weeks, my doctor, my OB, has ordered a glucose tolerance test. It's because I have a history of gestational diabetes with my first child and being overweight too. Because I heard here in the United States, if you're overweight, and if you have a history of gestational diabetes, they'll really order it earlier in your pregnancy. Just a precaution. So yeah, I failed. So my doctor instructed me to check my sugar 4 times a day, and just to make sure that I'm eating healthy and that I do exercise. Well, I'm doing my best. It's always easier said than done, but we gotta do our best for our child to make sure they're healthy as well and we're not putting them in harm. Anyway, having gestational diabetes is not totally our fault because it's our placenta. Our placenta is making a hormone that makes our blood sugar even higher. So even if you're not doing anything, your sugar will still be a little elevated. So that's why they always tell us, or the doctor always tell me, to watch out on what we eat. Make sure we eat a healthy, balanced diet, and of course not to eat a lot of carbs, especially white rice. Oh my gosh, being a Filipino, we grew up eating rice 3 times a day. So for me, I eliminated white rice, but I'm still eating brown rice and wheat bread. Anyway, so I was doing that for a while now, since I was 6 weeks. And then later on, around 14 weeks, I was instructed to administer insulin to myself, because as my pregnancy progressed, my blood sugar is getting higher too. So yeah, I was administering insulin to myself 3 times a day. So that is in the before breakfast, before dinner, and at bedtime. And anyway, I'll talk about it more on my 30 weeks pregnancy vlog, and I'll show you how I administer it to myself and how I check my blood sugars, like how I prick my fingers. So because for me, I'm using 2 kinds of insulin, the rapid acting insulin and the intermediate long acting insulin. So I have to mix them, and I have to be careful on mixing them. Going back with this week's update, so I'm 29 weeks and 1 day pregnant. So my baby is about a size of an Hawaiian pineapple. That sounds yummy. And then so she's about 16 inches long and about 3 pounds in weight. So that is about 1.35 kilograms. And she's almost getting there. Yay! Well, common signs and symptoms this week would be indigestion, because I read that this week our body is starting to release hormones to relax our muscles, to prepare us for delivery, and that makes our digestion slow. And with that, it's common to have acid reflux. So make sure we eat small but frequent meals. And then when we're laying down, make sure we lay down on our left side. And then yeah, what else? So also for this week, it's normal to be forgetful and having some dizziness. For me, since my pregnancy has started, I'm always having this back pain and round ligaments pain, especially when my bladder is full. So I have to make sure that I always empty my bladder to avoid that, because it's really painful. So I want to talk about my highs and my low. Like my high for this week is that I feel the baby's movement more intense, they're more defined. And then I'm just so happy to feel her, because it's really reassuring, because I get paranoid when I can't feel her that much. So my low for this week is that I'm having a lot of high blood sugars. So I mean, I'm still eating the same diet, but I guess it's just because my pregnancy is progressing and I'm getting more insulin resistant. And also one more low is that I heard it to a lot of people that my baby bump is smaller for like 7 months or 29 weeks. Let me show you. Oh yeah, this is my baby bump for 29 weeks and 1 day. Do you think it's small or it's just alright? Well, you know, I wasn't really concerned about it at first, because when I had my checkup last July 10 with my OB-GYN, she measured the baby, and she said the weight and the height are normal, and that the amniotic fluid is normal. So I really didn't worry about it until I heard a lot of people saying it's like small. But I mean, other people also said that for other people it's normal to have a smaller bump, and like at 8 months it will just show up like boom. But we'll see. And right now my baby is on a transverse position, so her head is on my right side and then the feet is on the left side. So hopefully in the next coming weeks she will head down to make sure that we will be able to do vaginal delivery. But if not, C-section is fine. For me, safety first. So okay, I guess that's enough for this week. And on my 30 weeks update, I'll try to show you how to administer my insulin and how I check my sugar. That's it. So if you like my video, please subscribe. Thank you.